Hi, Dr. Frega here with Ideal Health and Wellness, and this week I am 27 weeks pregnant. So I'm about a week away from getting my glucose test. And when they do the glucose test, they're also going to typically test some other lab work too. So today I was thinking we would talk about iron deficiency anemia, which is a common issue that women face during their pregnancy. So typically when you first go and see the OB, they're going to do general lab screens that are going to look for this initially. And again, depending on when you've seen the OB, whether it's at your 8-week or they wait till 12-week, that would be tested then. So typically if they're showing issues in the lab where you do have iron deficiency anemia, they will typically supplement you with that. Another time they're going to test it is with usually around your 28th week when they're doing your glucose tolerance test. They will do a series of other labs, and again, they're screening for any sort of iron deficiency anemias. Again, there are different sources of iron that you can take. One of the problems with iron, though, is that it can cause constipation, and a lot of women during pregnancy already suffer from that. So again, taking iron that is going to be a non-constipating form. I like to use the brand called Floridex, and it's a nice combination brand. It's easy on the stomach, tends to be non-constipating. It's also going to use some other herbals such as nettles, and nettles is a great herb, specifically the leaf itself. It's high in iron as well as vitamin C. Vitamin C will also be in the Floridex as well, and vitamin C is important because it helps with iron absorption. Other things that you can do if you have iron deficiency anemia is eat foods that are higher in iron, such as spinach, red meat, quinoa, lentils, broccoli, again, more of our green leafies, are going to be really good sources of iron to get through a dietary source during pregnancy. The other thing is that we can use acupuncture to treat iron deficiency anemia, and what they call is this blood qi yin deficiency, and that can be treated again working different channels to help promote the blood making in the body, which will help with iron deficiency anemia. So again, there's a bunch of different ways that you can approach this, whether you're supplementing with direct iron, again, picking a source that would be non-constipating, that's also going to include some vitamin C to help optimize absorption. There's also some great botanicals that you can take, and having an herbalist or a naturopathic doctor that can formulate a specific herbal tincture to help with, again, the iron deficiency, and increasing your iron supply and stores is important, because one of the symptoms of iron deficiency is fatigue, which again, it can be hard to kind of determine if is it fatigue with pregnancy or fatigue because you have iron deficiency, and again, that's where actually running the labs and assessing for that is important. So next week, again, I'll be taking my blood glucose test, so I'll probably talk a little bit about, gestational diabetes in pregnancy and ways to kind of prevent that through diet and lifestyle.